This program was first broadcast on Canterbury's access media station, Plains FM, and was made with the assistance of New Zealand On Air.
Today, I'm really excited to be joined by Bruce Penny from Listening to Families, which is a website full of really interesting content pertaining to families and children and the challenges and the system and a whole lot more. And it's a really great place to go for info. Thanks for joining us for Being Real Parents with me, Anna, and my colleague and buddy,
Kate. We work in the parenting space.
And it's here where we'll talk about our worlds as parents, the good, the not so good, and the hilarious, and mix this with what we know about behaviour and psychology. Hey, lovely to have you here. So good.
Thank you. Thanks for the opportunity.
Oh, you're really welcome. You're really welcome. So do you want to start by telling us a little bit about you?
Okay. I'm not sure where to start, but so maybe if I say that I'm 73 years of age, that will give some context to what I'm going to talk about. I have two sister children, a couple of older children who are 50 and 47, and a couple of younger ones who are 24 and 29. And having had a second go at childhood and families has been a real privilege. I started off in my professional career as a civil engineer.
Right.
In my last year at engineering school, I realised I didn't want to be a civil engineer, but it was too late to change, so I spent 7 years of being a civil engineer before I went into the timber industry, and then I set up my own timber manufacturing business, which I had for 10 years.
Oh, wow.
One of the things that led on to what I'm doing now and why I'm doing it was during the latter part of my time with my business, I was involved with the executive staff course, New Zealand Institute of Management program, and I picked up two things from that 10 years. First thing, the importance of facilitation. The facilitator of a group can often decide the outcome of the outputs from that group.
Yeah.
The facilitator can turn a group of average people into a really high-performing team. A poor-performing facilitator will struggle even with a group of really good people. And the other thing that I found was really important was if you get people in a room and start a conversation, you can do an awful lot of things and you can change things. And people don't get in the room these days and communicate. They talk via email and text and other modern social media platforms. But getting in a room and talking to people is really important. So that was really a light bulb moment for me when I realised the value of that. From 1997 through to 2022, that's 25 years, I've facilitated projects, led projects, worked as a contractor.
Ah.
So I started off with a project called Elder Care Canterbury, integrating and improving health services for older people.
Yep.
Then I did some work in a whole range of things, environmental management and funeral businesses and things, helping people with their business. Mm-hmm. But the deciding thing, or the defining thing, which led to me ending up where I am now, was in 2007 I started in a project in the health sector called the Canterbury Initiative. And that was a project focused on getting general practice talking to hospital clinicians and vice versa.
Right.
And over the period that I was involved with a great team there, we did every topic A to Z for medical, mental health and surgical. So we would get 3 or 4 GPs in a room with 2 or 3 hospital specialists and talk about what was working, not a lot, what wasn't working, heaps, and how we could go about fixing that.
Yeah.
And that led on to a web tool called Health Pathways, which is now used right throughout New Zealand, through Australia and in the UK, and currently being launched in Canada.
So that's the system that when you go and see your doctor, they look up, don't they? You see that, and whenever you go to your GP, you see that system being used, and then they'll often print from it to give you the information.
Exactly.
Yeah.
In the early days, we had patients saying, I've got some concerns about my GP. They have to keep looking at the computer screen. I don't think they're a proper doctor. And we were able to say they're looking to see the steps they have to take to get you the best outcome. And often that's some work in the community, and sometimes that'll solve your problem.
Yeah.
But if not, you've done the steps that need to be taken before the hospital specialist will see you.
Yeah, yeah.
We also did Health Info, which is a information website for the community.
Yes.
And those two things were really pivotal in what I was doing.
I did some writing for Health Info. Yeah, I'd forgotten. Yeah. Cool. That's cool.
So, that's me.
And
done
then
lots of things.
How did you come to... So do you want to talk us through what listening to families is? And then, I mean, it feels like the progression is your background in health, and it feels like the progression is also your wanting to support systems to work and flow better.
Okay. In that 15 years that I had in health, I observed three things.
Yeah.
It's very challenging to navigate your way around the health system. Even those who work in the health system struggle what to do, where to go, what to take, what information, what to ask. So to get from general practice to hospital to community provider, very challenging even for those working in the system. So hard to comprehend what it must be like for others who struggle with for a whole range of reasons. So that was very obvious. The second thing I observed from talking to various people was that when you met a clinician, they were constrained for time. Often it was the clinician talked at you and you didn't get a chance to ask your questions. Mm-hmm. So you came away with, and I'll come on to that point in a minute, but the consultation largely was you absorbing the information that was being targeted or provided by the clinician. And they do it with the best intention.
Yeah.
The third thing was the conversation that we've had, and it might be 10 minutes in the consultating room or 15 minutes, 80% of it is forgotten by the time I'm back in the car.
Quite.
90% plus by the time I get home. So when I get home and my partner says, well, what did the doctor say? I can only remember one or two things. And they say, well, you were there 15 minutes. I can't remember. And especially if you've gone, as an example, you've gone with a child, you and your partner are there with the child, and the clinician says, well, the tests have been done and your son, your daughter has ADHD, has autism. You don't hear any more from there. So that really troubled me, that challenging to navigate, my questions weren't being answered, and finally that retention of information.
You're listening to Being Real Parents with Kate and Anna on Plains FM 96.9.
That's really interesting. So those three observations led to your creation of listening to families.
Correct, but there was one other catalyst.
I'm sorry.
Right?
What's the other catalyst?
Well, at the end of my contracting time in March to May 2022, a colleague and I did a Zoom meeting with each of the 42 year 9 to 13 schools across Canterbury. Wow. So we had half an hour with the counsellors in each of those 42 schools. At the end of the 30-minute session, we asked the counsellor, what is the common presentation? The door knock on the door opens, student comes in, what are you seeing? Anxiety, eating disorders, self-harm. The level of acuity of those students was high, but not high enough to be seen by specialist mental health services. And they're, for many, beyond the skill set of general practice.
Okay.
So these counsellors were looking after these children or students, adolescents, and carrying a significant burden.
Yeah.
And that really troubled me. And I thought, is there something I can do about that? And that's where listening to families came from.
That's really interesting. And then listening to families is this, can I say, library of videos?
Yes.
That really delve into those areas and much, much more. And the videos are with practitioners explaining the process and the, in some cases, the diagnoses, if you like, or the mental health issue and what can, guide support care in those instances. But then also there are other videos from people who have been who have gone through this journey as well. Am I right?
Yes and no. The only point I'd clarify is this is not about diagnosis.
No.
This is about questions you have at the time you receive the diagnosis, but it's not about the actual diagnosis.
No. But there is information on there, for example, the one that I've looked at significantly and use a lot in terms of when I'm working with families is the ADHD, autism paths, and the clinicians there talking about what that means when you have ADHD.
Yes.
Yeah.
So most of our series start off with what is ADHD, what is autism, what is anxiety, what is an eating disorder. And so that's when the clinician will explain what that condition is.
Yeah.
But I think the point I want to really stress is that families have questions. And they're not the questions that clinicians think they have.
Yes.
So I will go to a family and say, what are your questions about your son's ADHD? What are your questions about your daughter's anxiety? And I'll get those lists. And then I'll contact the relevant clinician to answer those questions. And they'll say, oh, yes, I've had questions for many years. I'm sure it'll be this, and this. And sometimes it is this and this, but often it's a range of other questions, including things like earlier in the week we were doing a video series on parent education. And the team that were answering the questions provided a list of questions. The actual questions that came from the family member were different, like simple things like, can I bring my child's grandfather with me to the thing? They're just simple questions that people have. So one of the things that's been a standout for me in the 2 years I've been doing this is the disconnect between what clinicians think are exercising families' minds and what is actually happening. And when we answer what I observe in the meetings is the clinicians learn from the families and they go away with a different understanding of what it's like in the community and they share that with their clinical colleagues. The families go away with an understanding of the challenges for the clinician working in a constrained environment and they share that. So there's increased awareness of the difficulties on either side. But light bulbs go on and this is not a consultation. Clinicians interact with families in a consultation. You've got 10 minutes, you're here because you've got a diagnosis. They're relaxed, they're talking about something. They don't have to make a diagnosis. They're actually sharing a discussion. And there's been some really interesting interactions with learning going on from both sides.
And what I noticed too is that generally when we see practitioners in their clinical form compared to when they're on the couch inside of listening to families, is there's a relaxedness about them, but it's also an enjoyment because this is what they know well, and they really it feels to me like I notice them enjoying answering questions that are much broader than they get to talk to inside of just general practice. Yeah.
Great observation.
Yeah.
Yes.
Cool. So I'm using listening to families by letting the parents that I work with know that that's available for them to look at and getting great feedback. How else is this being used? I mean, we should also talk about what else is covered in there because it's not just a health pathway, is it, now? Where do you want to go? Do you want to start with who's using it and why? And then we look at what actually is in there? Right.
I've been really surprised at the way it's been used. So let's start with education.
Okay.
We get really strong support from counsellors and from schools.
Yeah, good.
And they're using it in two ways. They're using it when they've got a parent and the parent's concerned about something.
Yeah.
But we're increasingly hearing that school staff are using it as education for themselves. Upskilling on ADHD, upskilling on self-harm, upskilling on those sorts of things.
Yeah.
So that's been a surprise.
Yeah.
But people are using it. And I noticed that in terms of the traffic to the site, it's Monday to Friday. There's a lot, the traffic drops at the weekend. School holidays, it drops, which says to me that school teachers are having a really big impact.
Yeah.
In terms of health, general practitioners, practice nurses and health coaches and HIPs are using it. They're using it in two ways. They're showing one of the clips as part of the consultation. They're using it in a family meeting, like a health coach or a HIP, sitting for 30 minutes with someone saying, here's something, let's have a look at this together.
Yeah, good.
And then they take the card and they go away, and the family can use it at home.
Yeah.
And then thirdly, Stephanie Rollinson, who's been one of the great supporters of our program, runs our Facebook. She's also involved heavily with the neurodiverse community. So families are just going to it, scanning through and saying, this is relevant to my child, and watching. The reason the videos are between 2 and 6 minutes is people's attention span is short. We're dealing with many families who are stressed and short of time. They haven't got time to wade through 40 minutes of video, but at the end of the day, sitting having a coffee, they may watch a video clip of 7 minutes about a topic that's particularly relevant to the day's activity in the family, and that then hooks them in, and they may come back and review others. So there's the two ways. People are using it to educate themselves, health and education professionals, and families using it to understand more about the conditions that they're dealing with in their family, which is ADHD, autism, or other things.
Yeah. Okay, cool. Yeah, that's nice. I mean, yeah, I've also used it, like when I've been in Zoom meetings, sharing your screen is a great way to be able to kind of show families where to navigate to, as well as kind of show part of the clip to let them know that, you know, they're actually, it's so interesting because often the person that's being interviewed is the person that they'll see when they go through, you know, the pathway through CAFS or whatever. Yeah.
Autism is a good example of what you've just described.
Yeah.
Helen Wagstaff, who's recently finished as the autism coordinator for Canterbury, did a wonderful job. She introduces our series on autism and is involved in all the videos. She runs parents groups, or used to run parent groups, and when she'd turn up, people would say, "Oh, nice to see you in the flesh." And at the start, she'd say, "What do you mean?" And the people would say, "Oh, I've already seen you on the video clip. I know who you are." And it was an icebreaker. So yes, people are going to the site, looking at things, and then they go to CAF and they see Matt Eggleston, they see Fiona Prest, they see Jessica Corwell. They've already seen them and they know what it's like.
Yeah. And it's nice too, like I was saying, that, you know, they're more relaxed and they, I think it almost is kind of like it's a better introduction to a clinician, isn't it, in that form, as well. Cool. So since the kind of core subjects that you came across in terms of talking to school counsellors and what they were, you know, faced with each day, it's growing oodles.
It's growing rapidly, and that's a little bit challenging, but it's particularly exciting. So can I just explain where the topics came from?
I would love to. Yeah.
So the initial topics came from the response from those 42 counsellor meetings. But then I'd be out socially and people say, "What are you doing?" And I say, "Are you retired?" And I say, "Oh, sort of not really. I'm pottering it around." "What are you pottering around with?" And I'd explain, "Oh, right, my son's got ADHD. I said, "Well, tonight, you go home and write down what keeps you awake at 2 o'clock in the morning. You write down the questions that you and your partner have and send them to me. Because of the 15 years I had in health, I know all the people, so I can just pick up the phone and say, 'Hi, Matt, Bruce Penny. Hi, Bruce, how's the fishing?' And we have a bit of a chat. And I say, 'Hey, look, Matt, you're the New Zealand expert on ADHD. I've got some questions. Would you be happy to answer them?' And without fail, people said, 'Yep, when could you do it?' 'I can do a Wednesday afternoon,' and away we go. So the topics like ADHD, eating disorders, all of those things, the vast majority of them have come from a social interaction. I'll give you an example. Every morning I walk to Taylor's Mistake along the beach. Halfway down the hill, there's a guy who I've met who's got a son. Turns out from a discussion, he's got a son with OCD. So I'm in the process now. He's identifying the questions. I'm working with Valerie Black from CAF to find out who will answer the questions, and we'll do a video series on that.
Cool.
The key message here that I want to share is that I've been so fortunate to work with such a special group of people. I talk to someone, they say, "I'm on," and the next day when I get home, my email inbox has got their questions in it. They're good to go. When can we do this? So what you see on Listening to Families largely reflects a lot of good-to-go people who are keen to get on with it. So when it's all a voluntary thing, you just work with the willing.
Yeah. That's it. Yeah, and I suppose that also contributes to the kind of, sort of the rawness of it as well. Yeah, good enough is perfect. Hey.
I'm glad you raised that because this is a group of volunteers.
Yeah.
This is a low-budget thing. Maya, who've been fantastic, fund the videos.
Yeah.
My grandson does the IT, who's 14, does the IT behind the scenes. The rest of it's all voluntary. There's no scripts.
Lovely.
We just get in the room and we talk. It's a conversation.
Yeah.
And I say every time, ums and ahs are mandatory.
Yeah.
This is not a rehearsed performance.
Yeah.
So
Real. We like real.
Exactly.
Cool. So, so that's how you've come up with the topics. There's something like, did you say over 50 videos on there now?
450 video clips as of today, and by the end of the month, there'll be over 500. And I was just doing a projection out to the end of the year, we'll have 800 clips.
Okay, so my 550 was just ridiculous. Okay, cool. So, what would you suggest? So if I was a parent and I had some questions around my child, I can go to the site. It's all broken down, isn't it? It's like I found it really easy to navigate. You're not going to be faced with 450 videos at once, I promise. And there's the topics that we've been talking about. What's the new additions in there? Parenting education you were talking about?
Yes, we've just done anxiety in adolescence, and we only published that last week, and there's been an enormous amount of hits on that.
Yeah.
The new topics that are coming up, the parenting programs, allergies, anaphylaxis and eczema.
Right.
School attendance, we've recorded yesterday.
Nice.
One of the good ones that's going to be recorded later three that are being recorded later in the month, CAF, talking about what happens when a referral is declined and all the work they put into getting the right outcome for the families. Cancer in adolescents and young adults. Ophthalmology, paediatric ophthalmology. So it's a real mixture. Coming into July, continence and toileting, fetal alcohol, OCD, ODD. So those are the topics that are lined up. In terms of a parent, if you go to the homepage and just click on topics, then you get a list of topics. And if you click on ADHD, then each of the series has its own heading. So we've simplified. In the last month, we've really simplified it, and the navigation is easy and simple. And we really get good feedback from people about the ease of navigation. You don't have to wade your way through 450 video clips. And
to find it, www.listeningtofamilies.org.
.co.nz. I had an interesting experience a couple of days ago around the OOD. I've been put on to Emerge Aotearoa.
Oh, wow.
And I rang them, and the guy that answered the phone, I said, look, I'd like to talk to you about listening to families. Are you sitting in front of your computer? And he said, oh, yes, that's already a shortcut. But when I do talk to people, if you go, we're getting sufficient traffic now. If you just go to Google and type in listening to families, it'll come up.
Yeah, cool. Thank you. Bruce and I have just been talking about the top tips, and actually we've reframed it today and calling this the gifts of people. So in terms of the gifts of people, one, our learning across this at Listening to Families is...
There's some wonderful people out there. Listening to Families came out of a 15-minute brainstorm with some special people. And if you listen to people and have the privilege to work with special people, you can do amazing things.
Yeah.
Number two is I've been just blown away by the people, the family members who come and ask the questions. Some of them with really challenging circumstances, neurodiverse kids. I had a mum turn up late one day, slightly late, driving to the session. She'd got a phone call. Her child had, as she described it, a meltdown. She had to go back, sort the child, come back, still walks in, big smile on her face, actively participated. It has been inspiring to watch these people and listen to their stories and still see their energy and enthusiasm. Really special.
And then number three, I was talking about the accounts that we hear, people's stories that we hear, the clinicians talking about it and how kind of positive it is. And I always come away from it feeling positive as well, which is why I recommend it so readily. And the reason for that, in my opinion, is because you see authenticity, you see thoughtfulness, and you also feel validated as a part of their journey. Yeah.
I think the thing that we set out as an objective is to help one family a day. And if we can help lower the stress levels with mum and dad, help them with their mental health, they're better in themselves, but they're then better equipped to help their child or adolescent. That's their objective, to do it one family at a time. And it's really great. The feedback we get suggests that we are able to do that.
Yeah, nice. Thank you so much for your time.
Thanks for the opportunity.
To find Listening to Families, it's super easy, listeningtofamilies.co.nz, or just Google and it will come up as your first option there. I would also recommend that you join their Facebook page as well, because it's such a nice way to get little snips of the content and see what's going up in terms of real life. And then the other thing that I need to say here is that if you want to work with us at Real Parents, you can contact us at www.realparents.org.nz or me directly, Anna at realparents.org.
Awesome. Thanks for being with us today.
We hope you've learned that while parenting is challenging sometimes, that's totally normal. It's been fun having you with us. Keep being amazing.